Welcome to Nursing Stories from the Heart. My name is Beth Matarasso and I'm joined by my friend and nursing colleague, Cheryl Burns. Together we acknowledge the traditional owners of the lands and waters from which we're speaking, the Turrbal and the Yuggera peoples, and we offer our respects to their elders past and present. As you listen to Nursing Stories from the Heart, we hope you'll be inspired to tell your stories too, because we know you have them. Cheryl, you're reading to us today from your memoirs, Memoirs of a Matron. What story are you sharing with us today?
Well, I'm sharing a story about this beautiful elderly lady I cared for when I was a student, actually. So I'd just like to go ahead with that.
Sounds great.
Thank you. So I'm leading into the story, Beth, just with a bit of context, okay, about basics.
Yep.
I always put myself in the patient's position, and this continued throughout my career. I know that after I had surgery, the best thing that I had was a lovely wash and a cup of tea. It just felt so amazing on my skin. This legacy should continue. It's part of healing. It's part of basic care. We cannot lose these basics as part of our nursing care. I say they are important things. It's part of connecting to our patients and comforting them. Of course, I would engage with them in these decisions as a partner regarding their hygiene, of course. I still believe that utilising this time with the patient while they are having their wash or freshen up is so important, and at that time one can pick up so many things about their condition, their treatment, their fears, their skin integrity, so many things, and any other concerns they may have. So it's so important that we engage with our patients during this time. So the story that I'd like to share with you today is I recall the time when I was sponging a beautiful elderly lady. She told me about her little dog, and she was so worried about it while she was in the hospital after she had a heart attack. She had been in the hospital for 3 days and had not shared this story with anybody. She missed him so much, so I sought special permission and arranged for her son to bring him in. To see her blue eyes light up was just an amazing thing to see. Some say that the wards are too busy to be able to provide this to patients. I disagree. Remember, this was the 1970s. This just didn't happen then. This was the start of me challenging the system, I guess. I believe in ruling from one's heart and head, and at this time I rule from my heart and my head, a little bit of the head as well. My head is equally as important, as I found later. So that's the story. It's about this lady who the main thing that was worrying her was her little dog. And she was really fearful for it. And I sought special permission, which took a lot of effort, I must admit, to actually have her bring that little dog into the coronary care unit. Yeah.
I can imagine. And as you said, it was the 70s, so it's that would have been quite groundbreaking. Yeah. When you were saying about, I think you used the word connections and comfort, I had a visual of you sponging, to quote you, this person, and I'm reminded about how important touch is, and we're talking about being human. And I always think with being human, we also have the challenge of staying human, because I think we can become very quickly institutionalised in work environments. But I had a beautiful picture of in my mind of you providing this sponge, and what came to me was that that sense of spirit and that connection of spirit and soul. Is that part of your story?
That's absolutely part of my story, and that's that intimacy with the patients that we talk about. And I found touch in my practice a very important part. To take touch away from the human being is actually something that's very negative. I just don't get the right feeling about that.
Yeah.
I am actually, of course, touching a patient is, with their permission, of course,
Sure.
and we have to be careful with that.
Yeah.
But, sponging the patient that touch. But if you take that away from patients, something's missing. Because touch heals people.
Yeah.
I found by even, when you're washing a person, by putting their hand in the bowl and touching their hand, they love that.
Yeah.
They loved it. They loved the touch of it.
I think even if you were taking somebody's blood pressure,
absolutely,
and you say, would it be okay if I rolled your sleeve up and I'm going to touch you as part of this, and place your hand on people, and of course, yes, there's you're learning a lot through touch, how the skin feels, a whole lot, but there's also that very, very basic connection that we have right from the time we're born. And when you listen to stories of people who talk about how long it's been since anybody touched them, like it's heartbreaking, really. But we do have so many opportunities to just be human in those very human of things, which is to touch, which is to smile, which is to be still, is to look somebody in the eye, is to just take that moment. I think, is this the story where you talk about the busyness of things?
The busyness of the wards and the busyness of work can sometimes take that away from you. The most important thing to that lady, I know the most important thing for us would be about making sure she'd recover from her heart attack.
Yeah.
But one of the most important things for her was her little dog.
Yeah.
And having that little dog that she actually was able to touch and pat, and the little dog was jumping all over her, to see her eyes, that was such a healing experience. I guess the reason I included that in my stories was to just share that human side of our practice. It's so important.
When I first read this story, and you talk about at the end of it, you talk about ruling from the heart. Sometimes you have to rule from the heart. What I thought about was, you don't use these words exactly, but I have for a very, very long time had a philosophy for my nursing practice. And what I've found across the years is that it has been something that has grounded me. It's been like an anchor for me. And sometimes when I've felt a struggle, or I've had feelings that I haven't quite been able to understand, and they could be from being sad to feeling really frustrated, about something. When I go back to my philosophy, there have been many times where I've gone, I've moved away. I forgot what was important to me. I forgot what I was meant to be doing here. And I think that all of your stories, again, you're talking about courage. I mean, the 1970s, I remember the 1970s, to have a dog in a hospital.
In a coronary care unit.
I can only imagine the carry-on and how much courage you had to have to stay with that woman's or person's wishes and see that through, because people were possibly still smoking in the wards at that time, but we couldn't have a dog.
Yeah.
But that's
right.
That's another
that's
story.
Exactly right.
But your courage to do that, and I think when you've talked previously about your values, when you've talked about how from a very young age you knew that this is what you wanted to do, as I said, in my mind, that's a bit like a philosophy for practice. And you continually connect yourself, but it's a choice that you make to continually connect yourself to what you say your nursing will look like, who you will be, because there's a lot of doing, but this is about who you will be as a nurse. And I think that shines through your book, but definitely it shines through in your stories.
And I think we talk about the art and the science of nursing. Mm-hmm. This is the art.
Yeah.
The art of nursing. These aspects. The science, yes, we need that. We need to understand the physiology. We need to understand the pathophysiology, or how medications are working, et cetera, But the art of nursing, and that point that you made in the previous podcast about intimacy, that aspect is still so important. And even today, it is more important in this complex world we live in.
Because we are doing the work anyway, so we can choose to say, again, just to use a very basic example of measuring somebody's blood pressure, you're there anyway. You're standing there. You are doing
So
what you are doing.
So you can actually engage with your patient.
Yes, you
and
can
the family.
choose how that will be.
You can choose how that will be.
Yeah.
And that's important to do.
Yeah.
Exactly.
I've seen nurses who, in doing that, have, there's been kids there that have said, "Would you like to come over and see how this works?" And it's been a really beautiful thing to see, because it's been very inclusive. It's acknowledging that the person in care has a broader context than this. There's another life, and it's such a simple thing to do, and it's not extra to. It's just making it a choice there and then to be very present and to do something in a different way.
I think that's a very big part of nursing practice, Beth. I really do. I think that we can never lose that.
Yeah.
It's very important. As a leader, I would always encourage nurses, if I was doing a ward round, which I'd always do every morning, actually, when I was director of nursing, I'd encourage people to listen to their patients, to listen to their stories, have the time. We actually can make the time while we're doing our other tasks.
Well, the time is the time,
time's
isn't it?
The time.
You've just got the time you've got.
The time.
But you can choose how to be in that time.
That's exactly right. Exactly right, where it's so important.
Yeah.
It really is.
What strategies did you have then for, because we're talking about being human, and we're talking about staying human. Tell us about in this story where you talk about, you had to, I assume, push and not take no for answers. I can't imagine the first time you asked it was like, "Oh yeah, that sounds okay, just ask so and so." I don't think it would have been like that.
No, it wasn't.
What can somebody learn? How can somebody navigate this? Because if you are told no, it's disappointing, and you might think, "Oh well, there's something that I don't know about." When you talked in our first podcast about being curious, are there questions that we could ask?
So I guess the thing that I did, which I didn't write about, because I actually had, in my nursing stories, I sort of changed them a little bit. I didn't want them to be specific.
Yes.
Sure. So that people could be identified. So I did change them. But the essence of the story is still there. I was a student, actually.
Yes, I know.
So and which is another...
That's a big deal.
That's a big deal. So being a student...
You were being taken notice of very early in your career.
I was a mature age student.
Yes, yeah.
So that probably may have allowed me a little bit more freedom, I guess. I don't know. But
well, you had a bit of life and living under your belt.
I had life and living. But, I think it shouldn't deter anyone by asking the question. To me, I've always asked the question. So I went up to my team leader and I said, Mrs. So-and-so really is very worried about her little dog, and, I'd really like to be able to allow her son just to bring her in for a little while so she could see her. It's part of her healing. And she said, "Oh, I'll have to go and ask somebody else." So it went up the line. It went up the line a few times. And
but it's impressive it wasn't a no straight off the bat.
No, it wasn't a no.
Yeah.
It wasn't a no straight off. So that gave me encouragement to keep going. And the charge nurse came and said, "Well, it's not really our policy." And I said, "Well, do you have a policy on it?" But they didn't, about animals being in the wards. But at the end of the day, I was able to, because I actually was very strong on being this lady's advocate. Yeah. I was able to really speak for her and walk in her shoes. Yeah. And really tell the story and say that this was one of the most important things. And she was elderly. Who knows? She may have had limited time, and this was so important for her. So eventually, they got permission from the after-hours nurse manager. They went up the road again, and then that person came down and had a chat to us, etc. And so it took a fair while to get it, but eventually we got permission. And I say we, because it wasn't just me, it was all of the people that I was speaking with helped get the permission for us to bring that little dog in.
So a hefty dose of persistence.
Yeah, absolutely.
Yeah, and I've got to ask you this question because, and you don't read this story, but toward the end of your book, you talk about putting lipstick on, and I have called that lipstick leadership. But I've got to ask you, did you have lipstick on
Yes.
when you did this?
I always wore lipstick. I always in my book I talk about when I used to have to chair really difficult meetings. If I had my lipstick on, I could deal with anything, because having to chair, multidisciplinary meetings with difficult situations, etc. No matter what situation you're in, even not meetings, but walking through a hospital, challenging situations, etc. If I had my lipstick on, I could deal with anything. If I didn't have my lipstick on, it was a bit of a challenge. I found that.
So coming back to stories, because we're talking about stories and we're talking about we want nurses to share their stories. I'm confident we want to raise awareness of the fact that we're in a story. Whether we like it or not, we are in a story. So to have a raised awareness about where a story's unfolding in front of us, this person has a story, your person with the, write about what she may have been feeling and experienced as a result of the dog not being there. But there's that story, there's your story. We are all in these stories together. Again, we're choosing who we want to be and how we want to be within those stories, because I think that to stay human, and we'll have different interpretations of that. I don't actually think that that's an easy thing to do. I don't think you can stay human without a conscious commitment.
No, it's about the consciousness.
Yeah,
you must have the consciousness.
Yes, to be, to feel, to hear. Because the easiest thing, and I'll just think about a hospital setting, big and busy, the last hospital I'm thinking about, I've determined that the easiest thing in the world is to not see people. You're racing off to a meeting, somebody's, I've seen people, I've felt the urge myself to beat somebody my dear old mother on a wheelie walker, to beat somebody on a wheelie walker to the lift, to press a button really quickly because you've got to get up to late for a meeting. So, but to slow down and to make a commitment to be present, to feel, to hear, to smell, to see, I think is integral to staying human.
But being a nurse, that's actually part of being a nurse.
Yes.
It's part of that. What we sign up for is that part of being human.
But I was a nurse when I was thinking about racing the person to the lift.
Yeah, but you can think about it.
Yeah, sure. Yeah.
But did you?
No. No, I have a sense of occasion. But no, I didn't. But I suppose I'm just saying that unless we make the commitment to stay aware.
We have to make the commitment to be aware. Yeah. We can't let the busyness, we can't let all these other things, that's what I talk about, well, the glue to the system. If we allow all these issues and things to come into this glue of nursing, right, to keep it all together, and that's to keep us together too as humans, it will be a challenge. But we as nurses, the human side of nursing has to be maintained. We have to be conscious of that empathy, putting ourselves in people's position. They're in the position they're in. Always remembering that. To me, that's so important about the role of a nurse.
And my mind goes to things like professional practice models, things that make explicit, nursing values, the values that nurses aspire to, as well as other things, programs that are specifically about being and providing care that is person-centred. We have to breathe life into those things, don't we? Because
absolutely.
They're one-dimensional unless they live and breathe in us, and we become the walking professional practice model. We become the program that is around being person-centred. You don't do it; you have to be it.
You have to be it. Absolutely. Nursing. Remember, statistically, across the world, the profession of nursing has always been the most trustworthy profession. And I think it still is to the last time I read about it. That just doesn't happen.
Yeah.
Without a lot of work, without a lot of that human side we bring into nursing and the practical, the art and the science, all those things. Yeah.
Oh, it's beautiful. And for myself and, family and children, I've certainly had the honour of, having nurses work with family members who I've just felt so proud to be a nurse. Just watching and observing as they might, depending on the situation, quietly going about doing what they're doing, knowing when to not be front and centre in a situation, knowing when to be, bringing other people in, like that example of the blood pressure, just knowing, and it's a beautiful, humbling thing. And as I say, it has made me very proud many times to be a nurse.
Yes, absolutely, me too. I think that I guess you sort of you sparked a little thought in my head about when I was a student, I got into trouble for laughing. And
we're going to hear that great Cheryl Burns laugh.
I actually I got into trouble for laughing on the wards because the matron said I laughed too much, but I actually said that hospitals are, we're for healing, and laughter actually is the best medicine. That's what I always thought. But anyhow, I really toned it down a little bit, but when I was a student, but I still have that laugh. But I think the other thing is sitting on the bed I got into trouble for. But at times, it's that human side. I felt as though that I had to sit on the bed to hold the patient's hand when we were in a difficult situation. When the patient needed me to comfort them, and I don't know whether they're still going, whether that's still a no-no in nursing practice, but
I've been in trouble for that too. Birds of a feather. Yeah.
Anyhow, I think that that human side, Beth, is so important, and it can help with so many things.
Cheryl, I think it's time to wrap up. You've given us lots to think about and reflect on between now and when we talk again, and you're going to be sharing a story about nursing observations as a key function of nursing and of nursing care planning, and I'll be looking forward to that.
Okay, thanks.
Thank you for being with us today, and until next time, this is Beth, and you've been listening to Nursing Stories from the Heart.
And this is Bernsey from Our Hearts to Yours. We encourage you to share this podcast with your colleagues and friends, and we hope you enjoy them.
Do you want to tell them about your book?
Yeah, I'll tell them about the book. If you are finding value in these stories, and if you want to explore the history of my story, you can find my book, Memoirs of a Matron, in a bookshop. Your support helps us continue sharing these stories. I didn't really write the book to sell books. I wrote the book to tell my story and to let you listen to them.
And it's a great tale.
Thank you.